and welcome to the Congressional Hispanic Caucus Institute's 2022 Graduate Fellowship Program Capitol Hill Briefing Series. I'm Marco Davis, President and CEO of CHCI. This series is the culmination of CHCI's premier 9-month graduate fellowship program, which offers exceptional emerging Hispanic leaders unparalleled hands-on experience in public policy. This unique fellowship program seeks to enhance participants' leadership abilities, strengthen their professional skills, and increase the presence of Latinos in public policy areas, most notably in the areas of health, technology, housing, energy, social equity, child welfare, and education. CHCI is thrilled to be able to offer our graduate fellows the opportunity to share their perspectives on policy issues that they're passionate about and convene leaders in this work for an informative conversation. Now, we'd like to thank our Graduate Fellowship Program sponsors for supporting the program, including Facebook, the PepsiCo Foundation, America's Health Insurance Plans, BBVA, Casey Family Programs, the Walton Family Foundation, the American Petroleum Institute, DaVita, Wells Fargo, and CVS Health. You can keep today's conversation going by using the hashtag CHCI Fellows on social media. And please visit chci.org to learn more about our Graduate Fellowship Program, as well as our other leadership programs and special events. And we encourage you to reach out to our fellows via LinkedIn to find out more about their policy work and help them connect with job opportunities for when the program concludes in May. Now let's get to the briefing. Enjoy the discussion.
Hello, my name is Caroline Gonzalez-Scott, Vice President of Programs at CHCI. Join me in welcoming Senator Ben Ray Lujan, representing the state of New Mexico.
This is Ben Ray Lujan, United States Senator from the great state of New Mexico. Today, I'm thrilled to welcome you all to this panel discussion that centers on two critical issues, healthcare and immigration, hosted by CHCI fellow Omar Ibarra. Serving in my office for nearly 8 months, Omar has truly left his mark. From assisting my legislative team with in-depth research to actively participating in the legislative process, Omar has shown exceptional growth and determination. In particular, Omar has made amazing contributions to our healthcare policy team. His extensive research, including on undocumented immigrant access to healthcare, has made him an invaluable member of Team Lujan and our fight to make healthcare more equitable for all communities. This important conversation you are having will make a difference in someone's life. In too many states throughout our country, undocumented immigrants play a vital role in our everyday life, but it's past time that our policies reflect that. This is true especially for rural communities back home in New Mexico and Omar's home state of Oklahoma, in addition to countless others. Through these discussions, we continue to lay the groundwork for a strong foundation rooted in compassion for those who have known of no other home but the United States. In the Senate, I'll continue to be an active partner as we work together to combat healthcare disparities. Thank you and enjoy the discussion.
Thank you so much, Senator Ben Ray Lujan, for that warm and kind introduction, and thank you for being a champion of equitable healthcare for all. We're also so happy to see you back in good health, Senator. I also want to give a big thank you as well to my sponsor, America's Health Insurance Plans, or otherwise known as AHIP. Now, good afternoon, everyone. Bienvenidos. My name is Omar Alejandro Ibarra, and I'm the 2022 CHCI's America's Health Insurance Plans Health Graduate Fellow. I identify strongly as Chicano, and I come from the Oklahoma Panhandle from the small town of Guyman. I'm the proud son of Mexican immigrants and grandson of braceros. I'm so excited to welcome you all to the 2022 Congressional Hispanic Caucus Institute Policy Briefing Series entitled Undocumented and Uninsured, The Road Towards Equitable Health Insurance for Undocumented Immigrants. I'm so honored to moderate this incredibly important conversation alongside a panel of outstanding individuals who will help shed additional light on this issue. Today, we'll be discussing the urgent and unmet need for undocumented immigrants to have access to equitable health insurance in the United States, especially during the ongoing COVID-19 pandemic. As Senator Lujan mentioned, this issue comes at the intersection of two major areas, health and immigration. Now, there are currently an estimated 11 million undocumented immigrants in the United States, most of whom have very little to no access to affordable health insurance. Federal policy prohibits strictly undocumented immigrants from qualifying for almost all health insurance, including Medicaid, due solely to their immigration status. This federal exclusion and federal policy, such as the public charge rule, fuel discrimination and increase fears of deportation among undocumented immigrants, thus forcing them to wait until their health is considered an emergency to access emergency care. Without access to preventative care and most affordable health care in general, undocumented immigrants may be more susceptible to infectious disease, and this has been increasingly concerning during the ongoing COVID-19 pandemic. This is a serious public health threat to this vulnerable community. There are several avenues to health insurance in the U.S., such as employer insurance, the ACA marketplaces, or more commonly known as Obamacare, and Medicare, all of which undocumented immigrants are not eligible for. One of the most central to immigrant communities historically has been Medicaid. Since its inception, Medicaid has played a pivotal role in the U.S. healthcare system. Medicaid is jointly run and funded by the federal government, but keep in mind that states have a lot of power over their Medicaid programs. It is the country's top public insurance system for low-income people and covers an estimated 75 million individuals. The program has helped narrow long-standing racial disparities in coverage and access to care, and has served as a crucial security blanket for millions who have lost their job and consequently their health insurance during this pandemic. Another disappointing aspect has been the explicit continued exclusion of millions of undocumented immigrants from Medicaid programs. Upwards of 45% of undocumented immigrants live at or near the poverty line, and they are 3 times as likely to live in poverty when compared to the national rate. Yet they are not allowed to enroll in the nation's central insurance system for low-income individuals. Without access to health insurance, undocumented communities are forced to rely on the country's already strained health safety net. Undocumented individuals very often wait until their health is in a state of emergency before they seek care, because they cannot afford the immense cost of healthcare. Other times, these communities do not seek care at all because they fear deportation or being separated from their families if they are caught. Opponents of this community often try to vilify them and claim that they pay no taxes and are only taking from the country. However, what opponents often leave out of the conversation is that undocumented immigrants pay over $11 billion each year in local, state, and federal taxes. In fact, their contributions have even been found to make the Social Security system more solvent or more sustainable, as they pay into the system but are ineligible to collect any of the benefits. This is to say, undocumented immigrants are paying into systems that benefit all Americans, but are purposefully excluded from any of the benefits because of their immigration status. Undocumented communities have been on the front lines of the COVID-19 pandemic, from working in the fields and meat processing plants across the country to essential construction and transportation jobs. They have long provided for us, and it is past time that we provide for them. Action must be taken to expand Medicaid programs or create health insurance options to include undocumented immigrants. Now, there are options available, and several states, including California, Illinois, Washington State, and Colorado, are pushing to expand Medicaid for subgroups of undocumented immigrants. Until federal laws are changed, local communities and state governments must lead the charge. Now, we're very fortunate today to have several people on this panel who have conducted research on this topic to inform policymaking, or who have been at the community and grassroots levels helping to organize for this cause. I'm excited for this session where our panelists will give us unique perspectives on this issue. Now, I would like to introduce our panelists for today's session. Our first panelist is Laurel Lucia. Laurel is the director of the healthcare program at the UC Berkeley Labor Center, where she has worked since 2009. Her research focuses on health coverage and cost trends in California and policies to improve access to and affordability of healthcare for California workers and their families. Laurel's recent publications have examined the impact of rising healthcare costs for workers in California, policies to improve access to health insurance for California immigrants, shifts in health coverage during the COVID-19 and health coverage and economic impacts in California of the possible repeal of the Affordable Care Act. She also provides technical assistance to policymakers and stakeholders, and her work has been covered in the Los Angeles Times, The Atlantic, and National Public Radio. Laurel received a Master of Public Policy degree from UC Berkeley and holds a bachelor's degree in public policy from Stanford University. Laurel, thank you for being here, and please take the floor.
Hi, good afternoon to those of you on the East Coast. It's an honor to be here at this briefing with co-panelists who have such deep expertise and experience with this really important and timely policy topic. Thank you to Omar and CHCI for the invitation. As Omar described, my research at the UC Berkeley Labor Center focuses on health coverage and healthcare affordability for California workers and their families. And I have a particular focus on health coverage for California immigrants. It's been a great privilege to have had the opportunity to do research related to California's policy efforts over the last 8 years to expand Medicaid to all low-income Californians, regardless of immigration status. I've done analysis related to the need for this expansion and estimated how many Californians would benefit and how much it would cost the state. And I've shared this analysis with state policymakers and advocates through publications and technical assistance and legislative testimony and media interviews. In California, undocumented immigrants make up the biggest group of uninsured in the state, after many citizens and lawfully present immigrants gain coverage under the ACA. In California, about 10% of all residents of the state are uninsured, but 65% of undocumented Californians lack coverage. And this is for a few reasons. As Omar described, undocumented immigrants are excluded from Medicaid and ACA eligibility under federal policy. But it's this disparity in the coverage rate is also because undocumented workers are less likely to get coverage through their jobs in spite of having high rates of employment. And lacking insurance, of course, has real consequences. California-specific research has shown that undocumented immigrants are more likely to lack a usual source of care and not get the health care they need, including preventive screenings. And I think the pandemic has really highlighted the long-standing health inequities that we have in this country. Many undocumented workers are essential workers in occupations that have had the highest death rates during the pandemic, like cooks, agricultural workers, construction workers, and housekeepers. And some undocumented immigrants have other COVID risk factors, like living in crowded housing or being more likely to commute via carpool or public transit. And so the lack of health insurance is another layer on top of these risk factors and exacerbates these risk factors. And a lack of insurance is also a barrier to testing and treatment. But I think in addition to highlighting the problems, the pandemic, at least here in California, my sense is that the pandemic has further reinforced how the health of each of us is really intertwined with the health of our communities. And so in California, we've made progress since 2016 in expanding Medi-Cal, but I think the pandemic is one of the reasons that we are hopefully on the verge of completing the Medicaid eligibility expansion here. And I look forward to talking about that more later in this panel.
Thank you so much, Laurel, for starting us off and for that perspective. Next, we have Dr. Lilia Cervantes. Dr. Cervantes is the Director of Immigrant Health and an Associate Professor in the Department of Medicine at the University of Colorado Anschutz Medical Campus. She is recognized for spearheading an innovative change to a Medicaid payment rule in Colorado to give undocumented patients with kidney failure access to life-saving maintenance dialysis. During the current pandemic, Dr. Cervantes worked with the state Medicaid agency to expand outpatient COVID-19 care for undocumented immigrants, launched a government-funded community-based intervention to reduce infections for Latinx communities, and conducted studies that assess Latinx COVID-19 disparities. Dr. Cervantes, please go ahead.
Hi, everyone, and good morning if you're on the West Coast. Thank you for the warm invitation and for highlighting this important issue. I've been a physician for about 14 years, providing care to undocumented immigrants, and I provided care to one patient that inspired me to really focus on advocacy and access to care for undocumented immigrants. I took care of a woman named Hilda. She was undocumented and had kidney failure, and because she was undocumented, did not have access to the needed dialysis. Instead, she had to come in on a weekly basis, basically when she was on the brink of death. As many of you know, the kidneys remove excess fluid and toxins from our body, and we cannot live without a functioning kidney. The most common form of treatment for people without functioning kidneys is hemodialysis, and that's when someone is connected to a machine for about 4 hours, 3 times a week, and they have their blood cleaned, the fluid and toxins removed. And this is available to U.S. citizens because of the 1972 Medicare entitlement program. So anyone with a diagnosis of kidney failure has access to hemodialysis as well as to other forms of kidney replacement therapy. Undocumented immigrants literally have to be on the brink of death to be dialyzed in most states. And so my patient, Hilda, who became a good friend, died on Mother's Day in 2014. And when she passed away, I decided I needed to build the research, the evidence base to change health policy. And so through research, I showed that relying on emergency dialysis causes people a higher mortality, worse quality of life, psychosocial distress. We also conducted a policy analysis and demonstrated that it would save healthcare millions of dollars by providing undocumented immigrants with regular access to standard dialysis. And so we engaged patients, community stakeholders, health policy folks, community-based organizations, and in 2019, our state Medicaid agency decided to include kidney failure as a qualifying condition for emergency Medicaid. And several states have also changed this because of Colorado's change. Other states that provide standard of care dialysis because it makes sense for undocumented immigrants are Arizona and several other states. Because of this experience, we've made other changes. I provided care during the pandemic to undocumented immigrants that were hospitalized and realized that most patients in our state and throughout the country don't have access to outpatient COVID care. And so we were able to engage the same stakeholders, and our state Medicaid agency similarly decided to expand qualifying conditions for emergency Medicaid and included outpatient COVID-19 care. And many states throughout the country have done the same, which is good. I believe as a clinician that access to care is an important social determinant of health. It's important for family financial security. And so during this policy brief, I hope to share some of Colorado's solutions because we have taken some legislative action and other measures to improve access to care for undocumented immigrants. Thank you.
Thank you for your insights, Dr. Cervantes, and especially for, honestly, your incredible work that you've done in the state of Colorado. Our next panelist is Edith Avila Olea. Edith joined the Illinois Coalition for Immigrant and Refugee Rights, or ICIRR, in 2020, where she works closely with ICIRR members and partner organizations. And she focuses on policy research, state-level advocacy, education, and outreach around the issues of public charge, healthcare access, and social services. Edith holds a Master of Public Policy degree from DePaul University in Chicago and a Bachelor of Arts degree in Organizational Communication from Shorter University from Rome, Georgia. For her part, Edith is a proud immigrant who hails from the great state of Mexico. Edith, go ahead.
Thank you. Thank you for the invitation and for the warm welcome and good morning. Being in the Chicago area, it's still morning here, at least for a little longer. So I before I get started about our work, I really just wanted to share a little bit about my own experience. I grew up in a mixed status family as an uninsured child for most of my life, and both of my parents are still uninsured, and so this work and this topic is really close to me personally, not just through my work, but because it really directly impacts my own family and many community friends and the community that I grew up with. So the Illinois Coalition for Immigrant and Refugee Rights, also known as ICER, is dedicated to promoting the rights of immigrants and refugees to full and equal participation in the civic, cultural, social, and political life of our society. Within our work, we have a few healthcare priorities that really aim to increase health access and coverage for immigrants. And in this work, we work to strengthen language access to laws and policies, expand hospital financial assistance for uninsured, undocumented immigrants, and other immigrants who currently don't qualify for insurance programs. We also assist health providers to learn how to create a welcoming environment. And we are growing what we refer to as Health Know Your Rights. And this is an expertise that we want to build for everyday immigrants serving everyday immigrants and immigrant serving organizations. Over the last few years, we've had some really incredible wins here in the state of Illinois. And in partnership with our community organizations like Mujeres Latinas en Acción, Southwest Suburban Immigrant Project, Mano a Mano, Enlace Chicago, United African Organization, and many more partners or members of ICER, we advocated for state legislation that expanded the Medicaid program for older immigrants, 65 and older. This was the first, Illinois became the first state in the nation to offer a Medicaid-like program for immigrants 65 and older, regardless of their immigration status. And we didn't just celebrate this victory, we decided to keep organizing, right? And last year, ICER joined this successful effort led by Healthy Illinois here in the state that further expanded the Medicaid like coverage program to 55 to 64. And so this year we are continuing the fight. We're not done, right? We still have a gap of immigrants who still don't have any access to insurance. And so we're pushing for all, the 19 to 54 gap. What we have learned over the course of our work is that within immigrant communities, there is still a very live misconception about healthcare. And some of these thoughts include, for example, that if I'm uninsured, I don't have any healthcare rights. Or if I am undocumented, I don't have any right to hospital financial assistance or any right to request language interpretation, amongst other services. And so our work is really to make sure that immigrants are empowered to not just know their rights, but really access those health rights. And so we have recently launched a program called the Immigrant Health Academy. And equitable access is really at the center of this work. We believe that all people, including immigrants, regardless of their immigration status, should be able to walk into any hospital or clinical setting and feel welcomed and not intimidated. And as healthcare continues to become a national priority, immigrants have not always been included in policy solutions at the federal level, which is why ICER has been working to shift their narrative to include access to healthcare for immigrants, regardless of status or their ability to pay. And so the Academy is a 2-year pilot project that's designed to create an immigrant-led leadership development and empowerment program that focuses on the intersections of healthcare access and immigrant rights and immigration law. And so we're super excited to be launching the program. Our first round of trainings, per se, is actually going to be starting this spring. And we know that, immigrants do have healthcare rights. But unfortunately, many community members do not fully understand those rights or are often don't fully trust providers because they're scared that their information might get shared with other government agencies, including immigration. There's also still fear of the public charge that we see alive in our communities. And so we really hope that the Academy will be a bridge to a bridge that would cover the gap that currently exists within the community in accessing healthcare.
Thank you so much, Edith, for your work and especially ICER's work to continue to expand health insurance to undocumented immigrants. Illinois is definitely one of the very few states in the nation taking the lead on that charge. So thank you for your work. Next, I would now like to introduce our final panelist, Samantha Artiga. Samantha serves as Vice President and Director of the Racial Equity and Health Policy Program at KFF, or the Kaiser Family Foundation. In this role, Samantha leads KFF's work to provide timely and reliable data and policy analysis on health and healthcare disparities affecting people of color and underserved groups. Her work focuses on advancing racial equity and health and the healthcare system at the intersection of racism and discrimination and social and economic inequities. Samantha, the space is yours.
Thank you so much for inviting me to be part of this important discussion today. And thank you, Omar and CHCI, for hosting this event. Again, KFF is a nonprofit organization that is focused on providing research and analysis on key health issues affecting the nation. This work has included a long-standing focus on the health and well-being of immigrant families, including their ability to access health coverage and needed health care, as well as examining how shifting immigration and health policies affect their health and health care. Overall, as you've heard already from some of our panelists, we know that immigrant families are less likely to have health coverage and to face more barriers to accessing care than their US-born counterparts. And I think it's important to recognize that these challenges affect immigrant families of all statuses and often include citizen children in immigrant families, but they are most pronounced among people who are undocumented or who live in families with an undocumented family member. And as you've heard, one of the primary reasons we see for lower rates of health coverage among immigrants is that they have less access to affordable health coverage options. The data show that non-citizens are actually more likely than citizens to live in a family with a full-time worker, but they're disproportionately employed in low-wage and hourly jobs that often do not offer health insurance to their employees. Moreover, even when it is offered, they're likely to face challenges affording it due to their lower incomes. As such, we see lower rates of private coverage among non-citizens compared to their citizen counterparts. And while Medicaid, CHIP, and the ACA marketplaces can fill some of these gaps in coverage for some lawfully present immigrants, undocumented immigrants remain barred from enrolling in federally funded health programs. This means undocumented immigrants don't have access to any public health coverage options aside from the limited number of states that provide state-funded coverage regardless of immigration status, many of which are joining us as part of this discussion today. Our speakers are from these states. However, beyond the limited eligibility for coverage, immigrant families may not enroll in coverage or access services that they're eligible to receive due to confusion or fears. Our research over the years with immigrant families has revealed that many fears about accessing programs and healthcare services substantially increased in response to Trump administration changes to immigration policy, including immigration enforcement efforts and changes to public charge rules that determine who can be granted entry into the country. While the Biden administration has since taken steps to reverse many of these policies, it likely is going to take significant and sustained efforts and time to rebuild trust and reduce fears among families. In the absence of coverage, many undocumented immigrants go without needed care and rely on safety net providers when they do seek care for which they may be billed. Looking ahead, expanding eligibility for health coverage for immigrants will be key for facilitating their access to needed healthcare and providing protections from high medical costs. As you've heard, some states are taking action to provide health coverage regardless of immigration status, helping to fill the gaps in coverage in federally funded programs. There's also been some pending federal legislation that would expand eligibility for immigrants, including some lawfully present immigrants who are excluded from federal programs today, and DACA recipients who are not considered lawfully present for purposes of health coverage eligibility. However, expanding eligibility on its own will not be sufficient. It's important for expansions to be paired with outreach and education through trusted members in the community to help people understand the coverage options available to them and to provide enrollment assistance, as well as to address fears people may have about enrolling in coverage. In fact, today we know that the majority of lawfully present immigrants who are uninsured are eligible but not enrolled in health coverage options. So there's room already today to increase coverage through outreach and education. Lastly, I just want to end by highlighting why it's so important to address the health needs of immigrants. As you've heard already, immigrants are a vital part of our nation. This has never been clearer than over the course of the COVID-19 pandemic, as many immigrants worked in the essential jobs that faced major risks to ensure we could still access food, services, and supplies. And at the same time they faced these increased risks, many remained ineligible for sources of federal COVID-19 assistance. Moreover, nearly 10 million children in this country, or 13%, are citizen children with at least one non-citizen parent. Given the vital role that immigrants play in our workforce and in our families, ensuring their health and well-being is important for the overall health and economic stability of our nation. I look forward to continuing the discussion. Thanks for having me.
Thank you so much, Samantha. And I also wanted to note, I really appreciate especially your last point, that expanding health insurance is simply not enough. It is also a matter of getting local communities involved to ensure that those communities feel trust in enrolling in health insurance and health services in the first place. So thank you for that. Now, I know our audience appreciates the different perspectives you all bring to this important issue area. At this point in the program, we're going to begin the facilitated Q&A session. I will start out by asking the first question and then open it up to the audience. In the spirit of equity and to stay on track, I ask that all panelists do their best to keep their answers to under 2 minutes. Here is the first question. Now, we have seen a few states that have been mentioned, such as California and Illinois, pass their own legislation to expand Medicaid to undocumented immigrants. And we have seen these measures fail in other states. This question is for everyone on the panel, but Laurel, we can start with you. You have done extensive research on this topic and have covered the initiatives in California. What do you think of the state initiatives that have been passed or proposed to expand health insurance to undocumented immigrants?
Well, I alluded to the expansions in California in my introduction, but I thought I'd give a little bit more background on what's already been enacted and what's been proposed. Starting in 2014, the California legislature has considered proposals every single year to expand Medicaid regardless of immigration status. In 2016, the state took the first step by expanding Medicaid to undocumented low-income children. And in 2020, that policy was further extended to young adults through the age of 25. Starting in May this year, the legislature and governor have already authorized for undocumented adults ages 50 and older to be eligible for full Medicaid benefits. And so together, these expansions that have already been enacted will cover an estimated 450,000 Californians. Governor Newsom and some California legislators have proposed to finish the expansion and fill in the gap for those ages 26 to 49 who are still left out. And policymakers are currently still in discussion about the implementation timing, but the governor has proposed that this would be effective January 2024. So hopefully in the next year or two, all low-income Californians will have access to Medi-Cal regardless of immigration status. And in total, more than 1 million undocumented Californians are expected to enroll in full Medicaid benefits once the expansions are complete. And these expansions are still relatively recent, so there's not yet a lot of data on the impact these expansions specifically have had on health or utilization. But as many of my co-panelists can speak to, there's a large body of research showing the importance of having health insurance for health, for access to care, for financial security. And I have no doubt that these expansions have already been very beneficial in these ways. These expansions have required some state investment, but they built on the existing federal and state spending for restricted scope Medicaid, which covers emergency and pregnancy-related services, which are some of the most expensive services. What undocumented Californians are lacking is coverage for primary and preventive care, care for chronic conditions, coverage of prescription drugs, those sorts of services. And the idea of building on restricted scope Medicaid has also been instrumental in getting people enrolled, because at least here in California, we have a very high share of undocumented low-income immigrants eligible, who are eligible for the full expansions, already enrolled in restricted scope Medicaid. So the expansions that have happened so far, the vast majority of people who've enrolled have been automatically transitioned from restricted scope Medicaid to full scope coverage. The outreach and enrollment efforts that others have mentioned are very important for addressing the concerns and fears that people have about enrolling, and also for making sure that people who don't have restricted scope also enroll in these expansions. Next month, our center will be releasing a publication showing that this proposal to finish the Medi-Cal expansion will be the biggest expansion of coverage we've had in the state since the ACA was implemented. And it would also significantly help narrow the gaps in coverage rates for undocumented Californians and also for Latinos. But there will still be work to do. Many undocumented immigrants have low income, but those with income too high to qualify for Medicaid will still continue to lack affordable coverage. And lastly, I just wanted to mention how these proposals have fit well into broader policy goals that California has been pursuing. First, the state has been trying to push as far as possible towards universal coverage, building on the ACA, not just in terms of these Medicaid expansions, but also improving marketplace affordability, for example. And this proposal fits well into that broader goal. And California has also been trying to be a more inclusive state of immigrants, whether it's these Medicaid expansions or, for example, making driver's licenses available regardless of immigration status. So this is a policy change that fits well into the broader directions in which the state is headed.
Thank you for those insights, Laura. Of course, California is one of the states that I think a lot of policymakers in other states are looking at to try to do something similar with their state models. Of course, Illinois is another one of those states. But I do also want to ask Dr. Cervantes for your insights. I know Colorado has some pushing that they're doing, which you are spearheading some of those charges. So I'd also like to give you a chance to provide an answer.
Yes. Omar, I would definitely add Colorado as one of those states that is leading in this area as well. In Colorado, we passed SB 9 this past year, which basically creates a Medicaid pathway for undocumented immigrants so that they can receive birth control and reproductive health care. And the funds appropriated for this are basically going to create the Medicaid program for undocumented immigrants. And like California and other states, the idea is to continue to expand, right? And so you might be hearing more news from Colorado this upcoming year about ways to expand that. We also passed SB 215, which is Colorado's Health Insurance Affordable Care Act. This brings in lots of money so that we can provide subsidies towards health insurance off the exchange for people who don't qualify for the provisions of the Affordable Care Act, like undocumented immigrants. So that's also was passed. And then we passed HB 1232, which is the public insurance option. And I think we're the third state now with that, which is really cool. So we're going to have an insurance option through every private insurer at a lower rate and available off the exchange for undocumented. And then we've also passed a lot of other cool things like licenses. Who would think that licenses are crazy important, but they are, especially for undocumented immigrants. One of the things I've been working on these last couple of years is access to transplant for undocumented immigrants. As many of you know, EMTALA explicitly excludes transplant for undocumented immigrants. And so typically states that provide transplant do so on a state-by-state basis. And it's really interesting that by signing up for a license, undocumented immigrants can sort of preemptively decide to donate their organs if deceased. And California is one of those states where when California implemented that law, they saw an increase of 30% organ donors. And so, it's yet one other way to sort of begin to create change, to say undocumented immigrants are part of our society. They want to contribute. They want to donate organs. We need to provide them with healthcare coverage and licenses. So I'll stop there.
Thank you for that, Dr. Cervantes. Colorado is definitely one of the leaders now, especially going forward. And I know we're all looking forward to see what happened to the state legislature and hopefully moving on to other states as well. Samantha, I do also want to get your take. I know that in your work, you cover health insurance for immigrants across the country. And so I wanted to see what you thought, since you look at some of the statistics more broadly and overall looking at some of the programs in different states.
Yeah, so certainly over the last year, we've seen a few states really taking action to fill in gaps in coverage for adults, regardless of immigration status, including California and Illinois, and Colorado, as mentioned here. This really builds on a lot of earlier work that many of these same states had done to expand coverage to kids and in some cases pregnant women, regardless of immigration status. And as you've heard from the panelists, this eligibility really offers the potential to help ensure that people are getting access to needed care and not putting off or forgoing care and ultimately landing up in worse health. As I mentioned in some of my opening remarks, the expansions on their own are really not enough because it's important that they really be paired with community-led outreach and education to help people understand that the coverage options are available, to help people enroll in the coverage, and then also for people to navigate the healthcare system, for example, if they haven't previously had a primary care doctor or are not used to receiving ongoing preventive and primary care. So it's important to think beyond just the eligibility to those additional steps to how do we translate that coverage into actual improvements in care and ultimately health. I will say that with this progress, we still have most states not having any coverage options available for undocumented immigrants. So while we're seeing progress in some areas of the country, there remain major gaps in other across most areas of the country. So this will mean that going forward, we'll continue to have unevenness in access to health coverage and access to health care, and that whether or not you can access health coverage and health care as an immigrant will continue to depend on where you live.
Thank you so much for that brief update, Samantha. I do also want to, there's a community component of that I want to hold on to for the next question that I do want to come back to. Before that, Edith, I want to give you also an opportunity to give your take on some of the maybe work you're doing at ICER or overall for the question. Go ahead.
Thank you. So the Medicaid expansion here in Illinois has we refer to it as the Health Benefits for Immigrant Seniors program, has been a lifeline for thousands of immigrants, without a doubt. So the program has been actually more successful than we even anticipated it. When we were advocating for this win, our Department of Healthcare and Family Services here in Illinois, or HFS, estimated that it would benefit around 2,400 immigrants. And nearly 2 years later, we now have over 8,000 seniors enrolled into the program. And I wanted to just briefly share a story that I recently was talking to a recipient of the benefits program, and she shared with me that she had fallen about a year ago. And it wasn't until a year and some months later that she was finally able to enroll into the health coverage program and received a much needed knee surgery. Because of the fall, she actually ended up having to move in with her daughter. She was not able to work. So there were a lot of long-term consequences from her not having access to health insurance. And the elder community member was in tears, thanking advocates for fighting for the health coverage program. But I also will say that it hasn't been a perfect solution. I think one of the differences between our program here in Illinois and California is that in Illinois, they carved out long-term services that include vital services like nursing care, rehabilitation facilities, and in-home long-term care. And so we, even though, right, senior immigrants right now do have access to primary health care and surgeries and whatnot, when it does come for a long-term need, we still have a gap. And we continue to see issues around that gap. So we're continuing to fight to push for legislation that will be inclusive, right? Because at this point, the only difference between the health benefits for immigrant seniors and Medicaid is the person's immigration status. And so I think we really see it from a perspective of equity, right? If we really want to be equitable in our healthcare services, then we must provide health benefit programs that are inclusive and that provide the whole care, so to say.
Thank you, Edith, for sharing first that personal story, but also some of the gaps. Of course, I think there's always going to be some gaps, especially right now as we try to make incremental progress in each state. I do want to come back to a point that Samantha's touched on a few times. Edith, I want to start off with you for this question. The Illinois Coalition for Immigrant and Refugee Rights has, for years, fought to organize, educate, and lead advocacy work on behalf of immigrant communities, and this includes fighting to protect these communities. From your perspective, what role do grassroots organizations and local communities play in extending health coverage to undocumented immigrants?
Thank you, Omar, for that question. I really think that CBOs and nonprofits like ICER play such a pivotal role in the not just advocacy effort, but organizing effort. And also, we are trusted messengers in the community. There is no doubt about that. And so we strongly believe that solutions need to come from directly impacted immigrants. And that's really how we prioritize the issues that we will be taking on as an organization. Together, we not only educate legislators, we also educate community members, and we mobilize people to hold elected officials accountable. And at the same token, we empower immigrant communities. As I was sharing earlier, and I think others have touched on, is that it's not just about creating a program, right, and that people will flood into it. There is a lot of education and follow-up that comes from the implementation process. We work very hard to break down the barriers that immigrants face in accessing these programs. Some of those barriers include like language access issues, the distrust and fear of using government services. And so oftentimes we know that community members don't use the term public charge per se. They might say something along the lines of, if I use this program, will it hurt my family? Or will it impact me in the future? And oftentimes they're referring to the idea of public charge, right? The idea that if I use a health program or financial assistance or whatever it may be, it really extends far beyond health coverage, that it will hurt their families. And so there is a huge hesitation that we see in community members. And as trusted messengers in the community, we're able to dispel those misunderstandings. We're able to journey with them, whether that be guiding them through the application process in the language, in their native language, in their preferred language. And these strategies really do make a huge difference, as we have seen in the enrollment of our health benefits for immigrant seniors program.
Thank you for that take, Edith. And I do also want to, for the sake of time, I want to allow one more person to answer. And I wanted to see Dr. Cervantes, in your work in Colorado, how maybe this has played into it, maybe getting community mobilization to help pass some of these initiatives, or thinking more into the future of how, if passed, actually helping to spread the word about the programs and also helping to build trust for people to actually enroll in those programs.
Yeah, no, I think that's absolutely critical. In fact, anything I work on in partnership with community because they know what the solutions should be. A lot of groups have been working on community power building, meaning that the community is the one that's actually leading the change because that's how it should be. And with the changes, especially those Medicaid changes, including the community, well, not including them, but partnering with them in this work has been instrumental to disseminating the information about the programs that are available to them. And so I would say, the community and the patients are at the heart of all this work and should be.
Thank you for that insight, Dr. Cervantes. I do want to move on to the next question. This one is for Samantha. Samantha, in your work at KFF, you help lead racial equity and health policy work and have put out briefs and fact sheets on the health coverage of immigrants nationwide, which has influenced recent research on this topic. What kind of effect could expansion of health insurance for undocumented immigrants have on the country's health safety net?
Well, as we've already discussed, first and foremost, expanding coverage offers the potential to increase access to care for undocumented immigrants. And this means that people may be less likely to prevent or to delay or forego care that they need. They may have better access to preventive and primary care. Together, all this may help prevent conditions from becoming more serious and ultimately more costly to treat in the long run. However, overall, we may also see some increased spending on healthcare for immigrants because today the research shows that immigrants spend less on healthcare than their U.S. counterparts, largely because they're using less care. At the same time, we know that coverage could help reduce financial burdens on safety net providers, such as community clinics and hospitals who are currently providing care that may not be reimbursed when people are uninsured. There's also the potential to shift some costs, as you've heard some of the discussion today. There is already funding that's being provided through emergency Medicaid that is covering some of the costs being provided to individuals who are uninsured and would be eligible for Medicaid otherwise, except for their immigration status. So some of the costs that are borne by hospitals in providing emergency care could now be shifted to other routes of coverage. So I think overall, there's already money in the system, but this would provide for more organized coverage, allow people to get the care they need, allow people to get preventive and primary care, which ultimately may prevent people from experiencing more serious and costly health conditions in the long run.
Thank you for that, Samantha. And I really, I want to also, Laura, I want to pass this same question on to you next, with also mentioning what Samantha just said about, especially with the fact that undocumented immigrants typically have to wait till their health is an emergency for them to access that emergency Medicaid or emergency care. And so I wanted to get your input on this question as well.
Yeah, I think Samantha covered the impacts on the safety net well. Like, undocumented immigrants are already using the safety net to some extent. There are already resources. What these Medicaid expansions would allow us to do is to better plan for the safety net capacity we need, and would provide more predictability to safety net providers. And what it would mean for patients themselves is that, right now, a lot of the cost of lacking insurance is borne by immigrants not being able to access the care they need, and it comes out in terms of their own health suffering. And research more broadly shows that when people have health insurance, they use more preventive care, they get more care for their chronic conditions, and that's exactly what we're trying to address with these policies.
Thank you for that insight from both of you. I want to bring it back now to Dr. Cervantes for the last question in this Q&A. Dr. Cervantes, I wanted to pose this question for you, since again, you've been recognized for spearheading a change to a Medicaid payment rule so undocumented patients with kidney failure could access life-saving maintenance dialysis. And I wanted to ask you, how could an expansion of health insurance for undocumented immigrants affect public health?
That's a great question. So I just want to very quickly stress the fact that undocumented immigrants contribute more in US tax dollars to our healthcare system than they use. And think about that as you consider expanding access to care for this community. When you expand access to care, you have healthier adults, which means that they're able to continue to contribute to that workforce. These last 2 years during the pandemic, what I have seen in the hospital is a disproportionate burden of infections, hospitalizations, and deaths, especially in undocumented. And that's because they have more cardiometabolic conditions like diabetes, kidney disease, heart disease. These are all things that increase their risk for worse outcomes like death. And so you just have to imagine the millions of dollars saved in providing preventive care for this community. Like there's no question. All the research points in that direction. We just have to do this, and either on a state-by-state basis through Medicaid or at the federal level. But it's clear that public health-wise, we will have a healthier community if we can provide care to those who are most vulnerable.
Thank you. And before we move on to the next question, Laura, I wanted to get your input as well about this question.
Yeah, I mean, not having health insurance has definitely been a barrier to COVID testing, COVID treatment. Here in California, we had a special Medi-Cal program for anyone who was uninsured to have their Medi-Cal testing and treatment covered. But I think, it's a very confusing patchwork system that we've developed, and a lot of people don't know about the availability of that program, or still have fear that if they get testing or treatment that they're going to get a big bill. And so, I think the problems of not having health insurance have been further highlighted during the pandemic.
Yeah, and I do want to stress it exactly what Dr. Cervantes, some of you have alluded to, that of course treating and expanding access to health insurance for undocumented immigrants can save the U.S. healthcare system so much money, because we would have healthier individuals. And of course, that contributes to public health, which is, of course, so important during this ongoing pandemic. Now, I want to first thank you all for those insightful answers. For the sake of time, I do want to move on to the audience Q&A. And to our audience, I want to let you all know, please feel free to put your questions in the chat box, and we will get to as many as we can. Feel free to engage with any of the panelists, and remember to direct each of your questions to a specific speaker in the format of a question for the sake of time. Again, to give everyone an equitable amount of time to speak, I ask that all panelists to keep their answers to, or at least try to keep their answers to, within 2 to 3 minutes. Now, the first question we have from the audience actually comes from Michelle. Michelle asks, how have policies such as the public charge rule affected undocumented immigrants and the immigrant community in general in enrolling in health coverage or in accessing health services during the pandemic? I want to bring this first question to Edith. I know you have some firsthand experience fighting against the detrimental effects this kind of rule has on immigrant communities, and I'd like to get your thoughts first. Please go ahead.
Thank you. So yes, the public charge rule, even though Trump's version is no longer in place, right? It reverted back to its original version. Still impacts the perception that immigrants have about accessing services, even if they're free. And so we worked really hard at the beginning of the pandemic to advocate that testing and treatment, and then later on, of course, the vaccine as well would be free for immigrants. But we found that getting an announcement from the governor was really helpful in building that or confirming that that testing and treatment were accessible to undocumented immigrants. One of the ways that we work to combat the chilling effect that we continue to see in our community is actually through the communication and the messengers that we see in our promotoras or community health workers. And they were really vital, are still very vital to educating community members about COVID vaccines and ensuring that they had someone that they could trust to ask questions and also journey with them throughout the process. Unfortunately, we have seen many occasions over the last couple of years in which wrongful billing has occurred, whether that be for a test or treatment or even the vaccine. And many times community members are not fighting these bills with the providers. They actually come to trusted messengers like the promotoras, like our ICER hotline, for instance. And we work with them and we work with the provider to make sure that these wrongful billing situations are addressed and that the patient does not end up paying for a service that they thought was going to be covered. But we continue, the pandemic has been a difficult matter, right? Because it significantly impacted our community, not just through the infection rates, but also financially. And so we continue to advocate for immigrants, especially for those who are going to be left out. And right now we are somewhat concerned, right, for the knowing that federal funding will run out and the impact that this could have on uninsured immigrants. The fact that they might not be able to afford a vaccine or to afford treatment. And if there is no funding for it, then they will be put in very difficult situations. So it is not an over situation, but we find the ways to combat it.
Thank you for that, Edith. Definitely the public charge rule has historically affected immigrant communities, and of course, not just the undocumented community, but because of the confusion surrounding it, it also affects immigrants at large. And with that, I do want to pass it on to Dr. Cervantes. I wanted to get your thoughts.
Yeah, something interesting is that the rule change went into effect just days before the first announcement of community spread of COVID in the country. And a lot of people don't realize this, and it actually really impacted things throughout the country. In our state, we actually did a retrospective analysis and looked at disparities by race and ethnicity. And we found that Latinos, especially undocumented, waited one extra day at home with symptoms compared to other racial and ethnic groups before coming to the hospital. And then we also conducted qualitative interviews and found that Latinos, they actually reported that they were hesitant to come to the hospital because they worried about discrimination. They worried about being turned away. And so, this has definitely impacted willingness from the undocumented community to seek care. And I think, with them having no safeguards, we need to make extra effort to reach to this community. And we've tried doing that in Colorado. There are various community-based organizations that are, actively in community with pop-up vaccine clinics, promotoras, trying to reach the community. But Colorado actually still has one of the lowest, basically one of the lowest vaccination rates among the Latino community. And so I just want to stress that, even though this public charge rule change has been reversed, we have to work really hard to build that trust again.
Thank you for that, Dr. Cervantes. Samantha, I wanted to get your take as well.
Yeah, we did a number of projects prior to the pandemic when the Trump administration rules were in effect, where we spoke directly with immigrant families. And as you mentioned, Omar, these are issues that affect immigrant families broadly across different immigration statuses. And I also want to emphasize that it's really hard to isolate the impact of public charge from the variety of other policies that impact immigrant families as well, and that they are just fearful for a range of reasons, including potentially jeopardizing their status in the future, risk of enforcement activities, being scared that, seeking services or enrolling in a program might jeopardize another family member, worried about the ability to bring other family members over to join them in the future. So there are just so many fears affecting immigrant families. And as Edith has mentioned, that's why it's so pivotal to have trusted members of the community working directly with families. In terms of the impacts we've seen related to COVID, we had some survey data that we conducted during the pandemic with Hispanic families in particular that showed that fears of both potential negative immigration consequences as well as potential costs served as barriers to getting the vaccine, even though the vaccines are available for free and available to everyone regardless of immigration status. I think some of these barriers were complicated by the fact that some vaccine providers request information on insurance or documentation such as a driver's license or identification, and that we continue to see some of these requirements being requested by some vaccine providers today. And so really thinking through not only how we communicate to folks that the vaccine is free and available to all people regardless of immigration status, but also making sure that people that don't have insurance or maybe don't have a driver's license or identification have an easy avenue to be able to access the vaccine regardless of where they're receiving it.
Thank you for that, Samantha. For the sake of time, I do want to move on to one more question from the audience that we got, and I wanted to pass this one on to you, Laurel. This question is from Isabella, and she asks, how can we empower people in our communities to access health services they qualify for as undocumented immigrants?
Well, I think some of my co-panelists have touched on this well in other remarks, but I'll just to tie it together. I think as Edith said, for example, like community organizations are really important in having the trust of undocumented immigrants in enrolling in coverage in the first place and in addressing the fears that people have with enrolling in coverage and in accessing healthcare services. And then once people are enrolled, it's really important to have assistance available for navigating our very complex and confusing healthcare system. And once people actually get to a healthcare provider, language access is so important to address, and having a diverse healthcare workforce that really reflects the communities they serve are all kind of considerations in empowering undocumented immigrants to access the healthcare services they need.
Thank you for that, Laura. Before we move on to closing remarks, I wanted to ask Edith if you have one last perspective for this question before we move on.
Yes, thank you. So this is really one of the reasons we launched our Immigrant Health Academy. And it's because we know that immigrants, for example, or some immigrants, I should say, will avoid an ER visit for fear that they will end up getting a huge bill and they won't be able to afford it. So I really think that it's really important to empower people through knowledge and at the same time to hold providers accountable in sharing the resources that are available to individuals regardless of immigration status. We have seen time and time again that if it wasn't for our advocacy on behalf of immigrants, hospitals would not share their financial assistance process. And many times we have fought wrongful denials of charity care. So it's not always on the patient necessarily to access those services. It's also a responsibility of providers to offer information in the patient's language and in a way that they can understand it, and to make sure that their policies are not putting up barriers that prevent immigrants from receiving the services that the provider offers.
Thank you for that input, Edith. I do want to make sure that all of the panelists have a chance to give their closing remarks, but thank you all so much to the panelists and to the audience for your questions and for the thoughtful discussion. I would now like to give each panelist 1 minute to give our audience a takeaway from today's panel, and we can start with Samantha.
Well, I think we've covered a lot of the topics really well today, and I appreciate hearing all the perspectives of my panelists. I'll come back to some of the points we made earlier. I mean, the research overwhelmingly shows that health coverage is key for ensuring that people can access healthcare and for providing financial protection from high medical costs from families. We're seeing growing efforts in some areas of the country to continue to fill the gaps in coverage that exist for immigrants, including undocumented immigrants. But in most areas of the country, immigrants remain excluded from federally funded health coverage programs. And that means that we'll continue to have these major gaps in the ability for people to access the healthcare that they need, which I think the COVID pandemic has really amplified and helped people to understand the implications of not having access to health coverage, not being able to access healthcare, not only has implications for the individuals affected, but for our community as a whole.
Thank you, Samantha. Edith, you can go next.
Thank you. So I really just want to end by uplifting community members and community leaders, because we have found that when we invest into immigrant leaders, that they are empowered to not only use their voice, they empower other community members to access service, to be educated in their rights to healthcare, and then to get involved in the advocacy process. We have seen this time and time again. So I strongly believe that they need to be an essential part to in the legislative process and identifying solutions that will work for their own communities.
Thank you, Edith. Laurel, please take the floor.
I think circling back to something we've talked about throughout the panel, the pandemic has both highlighted the depth of the health inequities, but it's also highlighted how interconnected all our health is, and I hope that the pandemic spurs more Medicaid expansions in other states, and a few years from now, maybe instead of California and Illinois and Colorado being the states that are profiled, I hope there's going to be a wide range of states that have been able to expand Medicaid and therefore, improve access to healthcare and financial security for undocumented immigrants.
Thank you, Laurel. And lastly, Dr. Cervantes, please go ahead.
I will leave you with the thought that everyone deserves to be treated with dignity. And most likely, if you're watching this, you're an advocate, and I encourage you to persevere. One person can make a difference. Build solidarity around the issue you want to change, and change it.
Thank you so much, Dr. Cervantes. Now, I'd like to thank everyone, including our wonderful and talented panelists, for joining us today to share their expertise and lived experiences. Their continued contributions, whether it's on the ground at a community or grassroots level, to research and academic work to informing policy, is all so critical to resolving this issue. It is exciting to see the steps several states are taking to expand health insurance for undocumented immigrants. However, more must be done, especially in the midst of an ongoing public health emergency. Undocumented immigrants work tirelessly to support the critical food infrastructure of the United States, and they contribute profoundly to the U.S. economy. They tend to take some of the lowest paid jobs where they are less likely to be offered employer insurance, and many live in fear due to anti-immigrant policies, rhetoric, and threats of family separation. For this reason, any solution expanding health insurance must include local community involvement, like we've talked about today. With enough community and political support, it is possible to ensure undocumented immigrants have the equitable care that they rightfully deserve. As one scholar noted, in a pandemic, we are only as healthy as the most vulnerable members among us. Now, I want to thank this amazing panel of experts again that spoke to us today about an issue that frankly does not get enough attention. But undocumented communities deserve our attention even more, and even more so deserve action. These are our people, y estas son nuestra gente. I also want to thank CHCI for their tremendous support in helping us to put on these important discussions for the public. Thank you as well so much to my amazing cohort made up of brilliant Latinos and Latinas. I highly recommend checking out the panels of fellows who went earlier this week. And please keep an eye out for the upcoming briefing later today, focusing on food insecurity by my friend and fellow Isabella, as well as the briefings by fellows Michelle and Tanya, who will be closing us out tomorrow. That concludes the panel. Thank you all so much again for attending the session, and enjoy the rest of your day.